Robert F. Kennedy Jr. gets his turn in the hot seat. We're going to talk about what happened and why it matters. I'm Jenna, and this is Smarter News. Well, we watched 3.5 hours of testimonies, so you didn't have to. President Trump's nominee for Secretary of Health and Human Services, Robert F. Kennedy Jr., will in fact have 2 Senate committee hearings. The first one happened on Wednesday in front of the Senate Finance Committee. The hearing started out with a familiar and much debated topic, with the ranking or the leading Democrat in the committee, Senator Wyden from Oregon, asking some tough questions.
Mr. Kennedy, you have spent years pushing conflicting stories about vaccines. You say one thing, and then you say another. In your testimony today under oath, you denied that you were anti-vaccine. But during a podcast interview in July of 2023, you said, quote, "No vaccine is safe and effective." Mr. Kennedy, all of these things cannot be true. So, are you lying to Congress today when you say you are pro-vaccine? Or did you lie on all those podcasts? We have all of this on tape, by the way.
Yeah, Senator, as you know, because it's been repeatedly debunked, that statement that I made on the Lex Friedman podcast was a fragment of the statement. He asked me, and anybody who actually goes and looks at that podcast, and we'll see this. He asked me, are there vaccines that are safe and effective? And I said to him, some of the live virus vaccines are. And I said, there are no vaccines that are safe and effective. And I was going to continue for every person. Every medicine has people who are sensitive to them, including vaccines.
Right. So
he interrupted me at that point. I've corrected it many times, including on national TV. You know about this, Senator Wyden. So bringing this up right now is dishonest.
Now, before we launch into some of the remarks today, let's just take a step back to take in this unusual scene. Robert F. Kennedy Jr. was a longtime Democrat from one of the most famous Democrat dynasties in American history. He opted to become an independent to run for president when he did not have the support from the Democratic Party to challenge President Joe Biden. Now, a Republican president, a former rival, has nominated this former Democrat to serve in a Republican administration in one of the most prominent cabinet positions. It's unusual. And this is something that Senator Johnson, a Republican from Wisconsin, underscored with this exchange.
Don't know if you remember when you called me up and you were contemplating setting your political differences aside, joining forces with President Trump on an area of agreement, addressing chronic illness, trying to find the root cause of all these problems facing this nation. My first response was, Bobby, this is an answer to my prayers. Ms. Kennedy, I think I've come to know what's in your heart. I think I know the personal and political price you've paid for this decision. I want to say publicly, I thank you for that. I truly appreciate what you're doing here. Can't we come together as a nation and do this?
I want to say something about what you first said. When I launched my campaign, it was about uniting Americans, Democrats and Republicans. There's no issue that should unite us more than this chronic health epidemic. There's no such thing as Republican children or Democratic children. These are our kids. I didn't know anybody with a food allergy growing up, peanut allergy. Why do 5 of my kids have allergies? Why are we seeing these explosions in diabetes, rheumatoid arthritis, neurological diseases, depression, all of these things that are related to toxics in the environment? Why can't we just agree with each other to put differences about so many issues, intractable issues aside, and say, we're going to end this?
Just a little background here. The Department of Health and Human Services is a huge department. An estimated 20% of the federal budget in recent years goes to health and human services. That means 1 out of every 5 of our taxpayer dollars. Under the umbrella of HHS includes names you know, the CDC, Centers for Medicare and Medicaid, the FDA, the National Institute for Health, and others. So that gives you some insight into the breadth of this department. Although many questions focus on the personal views of Mr. Kennedy rather than his leadership experience, and here's one reason why. The point of view of the Secretary of Health and Human Services can impact a lot of issues that can affect us every day. One of the key jobs for the Secretary of Health and Human Services is overseeing Medicare, Medicaid, the Affordable Care Act, including, what's covered, what are the guidelines. And government healthcare is important not only because it provides healthcare for millions of Americans, but how the government decides to cover treatments and medications can also impact the private market. The Secretary also oversees funding for the National Institute for Health, where research dollars go, what they focus on. And the Secretary can also take lead for public health emergencies, which we're all too familiar with. So these are just a few of the many responsibilities of this position. This department, though, is newish. It was created in the 1950s under President Eisenhower, and one of the first agenda items in this new department was the distribution of the first polio vaccine in the United States. So this helps us understand why the questions on hot topics like vaccinations, it's more than just questions because of podcasts or interviews. It's because the person in this position really matters and what they prioritize will really matter. Here's another exchange from the hearing that stood out to me because it provides some insight into decisions that could impact you and your dinner table.
Most importantly, we need to deploy NIH and FDA to doing the research to understand the relationship between these different food additives and chronic disease. If you like a cheeseburger, a McDonald's cheeseburger, a Diet Coke, which my boss loves, and you should be able to get them. If you want to eat Hostess Twinkies, you should be able to do that, but you should know what the impacts are on your family and on your health.
This hearing covered a lot of topics. Vaccinations was certainly one of them. But no matter how often Mr. Kennedy says this,
I believe that that vaccines play a critical role in healthcare. All of my kids are vaccinated. I've written many books on vaccines. My first book in 2014, the first line of it is, I am not anti-vaccine, and the last line is, I am not anti-vaccine.
Some don't believe him, and I wanted to play this for you so you could hear what he actually said on the record. Here's the bottom line. From my reporting, this hearing did not reveal a ton of new answers or new information. We got a lot of emotion. We've got a lot of topics that we've heard a lot about over the last several years. And this produces a lot of viral moments, but not necessarily some newsworthy events. So in an effort to give you something different, to give you something smarter, I'm always listening for something that sparks my curiosity. And I think this exchange with Senator Barrasso, a Republican from Wyoming, brings something to the table that doesn't get a lot of attention. By the way, Senator Barrasso was an orthopedic surgeon for more than 20 years in his past life. So just a little context. Take a listen to this.
There are a lot of challenges facing hospitals in rural communities and frontier areas. We have 33 hospitals in Wyoming, often hard to get to. Weather impacts them. 6 of the hospitals are at risk of closing. 2 are at immediate risk of closing in the next 2 years. Can you commit to working with us on a plan to address the critical nationwide issue of rural health care?
I visited almost 60 senators so far, and the most common unifying, I would say, issue among both Democrats and Republicans, there were 2. One was PBM reform, and the other is rural hospitals. And our nation made a commitment over 100 years ago to put up a hospital within 30 miles of every American. We generally succeeded in doing that. It's absolutely critical. It's life-saving. And rural hospitals are closing at an extraordinary rate right now. They not only provide important health care for the localities, but also they're economic drivers for localities all over this country. President Trump is determined to end the hemorrhage of rural hospitals, and he's asked me to do that through the use of AI, through telemedicine, which these are innovations that I saw the other day. A Cleveland clinic has developed an AI nurse that you cannot distinguish from a human being, that has diagnostics as good as any doctor. And we can provide concierge care to every American in this country, even those the remote parts of Wyoming, Montana, Alaska, et cetera.
Fascinating. Not only understanding the need for rural hospitals, but also AI nurses seems like a topic to watch. So Robert F. Kennedy Jr. will face another round of questions in front of another Senate committee this week. And one of those committees, one of these two, will vote to pass him along to the broader Senate for a vote where he needs a simple majority to confirm his nomination. As you know, Republicans have that majority, but he may not have all of their votes. He can actually lose 3 votes. If he loses more than that, he risks not being confirmed. And ahead of this hearing, the very first one, the count of the number of Republicans that he may lose varied from 1, 2, 3, 4, 5, maybe even 6. So it's important to watch this vote, but the timeline is to be determined. We'll keep you posted. A lot to think about here. Look forward to your thoughts. Thank you for your support of quick, concise, nonpartisan, smarter news.